Hello, I'm Dr. B from Doc B Well. Today on Wellness Talk, we'll be discussing high blood pressure, also known as the silent killer, because you could have high blood pressure and not know it. And elevated blood pressure can cause severe damage to your body and be detrimental to your overall health. Stay tuned as we discuss this really important health topic. And if you like our channel, go ahead and give us a thumbs up and subscribe so that you can be ready for the next episode. The following information is meant to be a resource but not medical advice. Opinions are my own but based on over a decade with direct patient care. Please consult your primary care provider for any questions or concerns. Today we are going to talk about blood pressure. We'll cover what high blood pressure is and who may be at risk. We'll discuss how you can check your blood pressure at home and provide some tips on lowering your blood pressure using lifestyle modifications. Stay tuned to the end when we introduce how telehealth and remote patient monitoring can assist you on your wellness journey. Blood pressure is measured using a special device called a sphygmomanometer, or BP cuff. It is recorded as two measurements. The top number, or the systolic blood pressure, is a measure of the maximum pressure in your blood vessels when the heart beats. The bottom number, or the diastolic blood pressure, reports the pressure at maximal relaxation of the heart muscle. Appropriate training and equipment are important in obtaining accurate home blood pressure readings. It should be obtained using a validated device that measures the blood pressure. High blood pressure or hypertension can be described as a silent danger, in that people may have elevated levels and not know it. It is with routine screening that we can uncover this hidden danger. Some folks may experience headaches, ringing in the ears, dizziness, nausea, or even vision changes that can warn of profound consequences ahead. Untreated hypertension can lead to strokes, heart enlargement, kidney disease, heart attack, or heart failure. In the United States, the prevalence of hypertension is higher among males, older adults, Black adults, those with obesity, chronic kidney disease, diabetes, and those living in rural areas. Additionally, high blood pressure can be caused by having untreated sleep apnea, a diet high in sodium, those who smoke, drink excess alcohol, and folks who do little physical activity. High blood pressure can run in families. Therefore, if your parents or siblings have it, you may have an increased risk too. The following definitions and staging system were described by the American College of Cardiology, the American Heart Association, in 2017. Proper measurement technique is of paramount importance when identifying patients as having hypertension. A normal blood pressure is defined as a systolic of less than 120 millimeters of mercury and diastolic of less than 80. An elevated blood pressure is when your systolic is between 120 to 129 and diastolic is less than 80. Hypertension is defined as stage 1 with a systolic of 130 to 139 or diastolic 80 to 89. And stage 2 hypertension is where your systolic is at least 140 or more, or diastolic is at least 90 or more. If there's disparity in category between the systolic and diastolic pressures, the higher value determines the stage. Using a blood pressure cuff in the brachial artery, that's the upper arm, perform measurements in a quiet room after 5 minutes of rest in a seated position, with the back and arms supported and legs uncrossed. At least 12 to 14 measurements should be obtained, with both morning and evening measurements taken over a period of 1 week every month. Many patients require the use of a large cuff, usually sold separately. Your provider will use the average of all available readings for clinical decision making. Check out our video on taking a home blood pressure using iHealth blood pressure cuff. A link to this video will be in the bio and will be available on our website. Scientists, supported by the National Heart, Lung, and Blood Institute, conducted 2 key studies. Their findings show that blood pressure were reduced with an eating plan that is low in saturated fat, cholesterol, and total fat, and one that emphasizes fruits, vegetables, and fat-free or low-fat milk and milk products. This eating plan, also known as the DASH eating plan, also includes whole grain products, fish, poultry, and nuts. It is reduced in lean red meat, sweets, added sugar, and sugar-containing beverages compared to the typical American diet. It is rich in potassium, magnesium, and calcium, as well as protein and fiber. Don't forget to get enough sleep and limit alcohol. Men should have no more than 2 alcoholic drinks per day, and women should have no more than 1 alcoholic drink per day. Do not smoke. Maintain a healthy weight and see your provider at DrB Well for details. It is recommended that adults get at least 2 hours and 30 minutes of moderate intensity exercise, such as brisk walking or bicycling every week. That's about 30 minutes a day, 5 days a week. Children and adolescents should get 1 hour of physical activity every day. Due to the many causes and consequences of hypertension, an initial in-person evaluation is necessary for diagnosis. However, follow-up visits and monitoring are well-suited to telemedicine. DrB Well utilizes remote patient monitoring iHealth device to record and send blood pressure readings to your provider. Routine lab tests can be ordered with our partnership with Quest Diagnostics to monitor your kidney function, check your cholesterol, and screen for diabetes. Virtual sessions with a nutritionist or health coach can be utilized on your journey to wellness and assist in your blood pressure goals. I hope you found this information useful. Remember to check with your primary care provider before starting treatment or to further evaluate your blood pressure. If you like this content, want to see more, drop us a like and subscribe. More informational videos are on the way. Let us know if there's something that you'd like to be covered in a future episode. Here's a list of my references from today's talk. As always, from my home to yours, wellness is a journey, not a destination.